Okay, so active range of motion at the elbow. We have flexion, so just bending the arm up, bending at the elbow. We have extension. Okay, with these we want to look for any restriction or pain while they're doing the movement. The other motion that we have at the elbow is pronation and supination. So supination, turning the palm up, pronation, turning the palm down. With these ones I always like to have the elbow by the side so that they don't cheat, because if the elbow's away and I ask them to go into supination, they may do the whole arm like this. Okay? So elbow by the side so that you can get specifically supination and pronation. Okay, so active movements, they're producing the movement. Right? Then we have passive movements, but I would again only do these if they had some pain or restriction in the range of motion. So passively, I can take that elbow through flexion so that I'm doing the motion for Kathy. Or the other way to do a passive movement is I can say, okay, Kathy, can you bend your elbow all the way? Now, if she has a little bit of pain at the end there, all I need to do is now take it at the end of the motion and see if she still has it. Okay, because now at the end of that motion where she initially had the pain in her active movement, which is using her muscles and tendons, then if I take that muscle and tendon out by actually passively doing the motion, then we would say, okay, do you still have the pain? If she says, yes, I still have the pain, then we're going to think that the joint is involved, okay, because I've taken away the muscle and tendon. All right? So passively, you can do that, just push at the end of the motion if that's where the pain is. But say she had pain right there, then I'm going to say, okay, I'm going to just relax your arm. I'm going to take your arm through a passive movement. I'm going to lift it and bend it. Okay? And sometimes it's hard for people to relax. If it's in sitting and I feel that they're having a hard time relaxing, then I'll get them to lie down to do this. Okay? And again, say maybe her extension, she goes to there. And I go, okay, can you take it any further? And she goes there. No, I can't take it any further. I want to know if she's just too weak to take it further or if she's flopped. So I'm going to take her through the range of motion, see if she can go all the way into extension. Okay? And I can do the same with pronation, turning her all the way over, with supination, turning her all the way over. So those would be passive movements. For the resisted movements, we have those 4 movements, plus we have 2 others. So if we're going to do flexion, we will say, Kathy, I don't want to move your hand. Don't let me push you down. Okay, so I'm resisting her flexion here. Kathy, don't let me bend your elbow. I'm resisting extension here. Okay. Then I like to do the politician's handshake. And for my pronation and supination, Kathy, don't let me turn your palm down. So it's more comfortable. Don't let me turn your palm up. Okay, there's no movement going on there, so it's not like, oh, don't let me turn your palm up. Okay. Plus, we want to do resisted wrist flexion and extension, and this is because the tendons that control this actually attach up at the elbow. So if we don't do the resisted flexion and extension of the wrist, we're going to miss if there's tendon problems at the elbow. All right. I like to do these more with the elbow straight because you'll get more signs and symptoms or positives at this position. So I would say, Kathy, don't let me push your hand down. Okay? So that would be wrist extension. Or Kathy, don't let me pull your hand up. And you can see how I'm stabilizing at the elbow, because if I just did, don't let me pull your hand up, she's going to have to fight with everything else. Okay? So then we have the special tests. So I'm going to get you to lie down. And we have distraction. You might want to come around on this side here, actually. Probably be easier. So I follow the order. So we have distraction of the elbow in 0 degrees. So I'm just pulling. Okay. And we have distraction of the elbow at 90 degrees. So I'm going to rest her hand onto my shoulder, squat down, and pull.
And you said that it targets a different ligament?
It does. It targets a little bit different joint to a certain extent and different ligaments, because when you're in extension, the hook is in place. So it's going to kind of almost jam that joint together at the olecranon process, but your radial ligament, or your radial head in its annular ligament, can be pulled out.
Okay.
Okay, that's that typical pulling the little kid's arm to stop them from crossing the street. Okay. We can do compression in the same positions. Okay, so to compress the radial humeral joint, I can push like this. So I'm pushing up with my lower hand, stabilizing with my upper hand. Okay, I can do the same thing, but now I'm going to have to bring my lower hand onto the bottom of her elbow. I'll stabilize her shoulder, and I'm just going to push up with my bottom hand, stabilize with my top hand on her shoulder. Okay? So I'm pushing like that and holding like that. Okay? You really only have to push with one hand. Then we have our valgus and varus stress of the elbow. These are to test the ligaments along the elbow. So remember, valgus forms an L. Okay, so I'm going to put one hand above her elbow, one hand below. Only one should move, so I'm going to stabilize with my top hand, and I'm going to try move with my bottom hand. Okay, now I'm exaggerating this so you can just see what I'm doing, but there's no motion that occurs there, so her elbow ligament on the inside is nice and solid. Okay. Then to do the varus test, I just switch her around. Put my top hand above the elbow, my bottom hand below the elbow. I'm going to stabilize with my top hand and try and pull this way with my bottom hand. Again, she's nice and stable there. Okay, no problems. And then our last test is for the annular ligament. And this one you'll want to be careful with because it's a tender spot, okay? So we want to find the radial head. To find that, we find the lateral epicondyle. We come down to the next bony bump. That is your radial head, okay? I'm going to put one finger in behind that, and then I'm going to find my bicep tendon, come just to the lateral aspect of that, and I'm going to have my radial head now between my thumb and my forefinger, okay? Because it's a tender area, be careful. What I'm doing is kind of an up and down motion to see if there's any movement there. Okay, now people may say it's tender. If it's tender, try doing it on the other side and compare, okay, because it may just be tender because of the place that you're pushing on. There's a nerve that runs right into it.
Jackie, when you say up and down, you mean like...
I'm doing this.
Okay.
Okay,
so from inferior to superior?
Yeah.
Okay.
If you want to say inferior, superior, or anterior, posterior, depending on if the position of the lower arm, right?
Okay.
Okay. But basically, if you put the radial head between your thumb and your forefinger, pinch it, you're moving it like this.
Okay.
Okay?
Okay.
All right.
Yep.
That's all of them.
Thank you.
Thank you.